Behind the scenes of longevity living, what's wrong with our nursing homes? Meet Karen. She is an 82-year-old living in the longevity living nursing home. She previously paid out of pocket, but when her savings ran up, she became eligible for Medicaid, which now pays for her care. Karen has mild Alzheimer's and mobility issues that are managed by longevity living staff. Unfortunately, Karen doesn't have any family in the area to check in on her to make sure she is receiving proper care. Meet Joanne. Joanne is a nursing assistant. She is a single working mother providing for her two children. Joanne makes just $10.51 an hour, summing to around $20,000 a year. She previously wanted to save money from her CNA job to go to school and get a nursing degree, but unfortunately, that now seems out of reach as she often puts in overtime hours just to make sure ends meet at home. Joanne has also suffered from a few work-related injuries, including pulled muscles in her back and exposure to infectious disease, but she doesn't take time off because she needs the income. Meet Carol. She is a registered nurse. She is one of 3 registered nurses overseeing care of the 90 residents at Longevity Living. She often has to rush through her care of the patients just to ensure everyone is seen. She is not paid as well as some of her friends that she went to nursing school with who work elsewhere, but she feels emotionally drawn to serve the nursing home population because she sees how often they are subject to poor care. Meet Greg. He is the owner of Longevity Living and corporate supervisor. Greg is a wealthy individual and additionally owns 3 other nursing homes. Greg usually spends 1 day a week at Longevity Living and knows the basics of what goes on, but he is very removed from any actual care that takes place on a daily basis. When Greg does see his direct care employees at work, he stresses documentation. He tells Joanne that if she is in the same room as Karen while Karen is eating, Joanne must document this as a continually supervised meal, not an independent meal, because then his nursing home is reimbursed for the service. Greg is inadvertently supporting residents' decline in order to bill for the most services and make the most profit. The nursing home care system is backward on a multitude of levels. Karen previously paid out of pocket to stay at Longevity Living, but when her savings ran out, she was forced to turn to Medicaid and subject to the fee-for-service system. For example, Karen is bathed daily. However, it is very likely that she is capable of completing this task by herself. Joanne is told to continue bathing her, however, so the nursing home can be reimbursed by Medicaid. This leaves Karen in a cycle of dependency. She will continue to rely on someone else bathing her as well as for other daily activities, and she will never regain the ability to live on her own. Medicaid financially rewards dependence and incapacity, as stated by Jason Rodriguez. This unnecessary extra task of bathing Karen also has a trickle-down effect onto Joanne. Joanne suffers chronic back pain as a result of repetitive lifting of Karen and other residents in and out of the tub, which she may not have faced if Karen was allowed to complete this task on her own. Additionally, as a result of this fee-for-service system, Joanne is subject to a low wage with little room for career growth when working as a nursing assistant. Direct care is a job that takes a lot of time with each individual patient. While a doctor in a clinic can fire through 30 patients in a matter of 8 hours, the individuals like Joanne who are actually providing the care can only care for about 5 people for an entire day. In 2008, the average hourly rate for direct care workers was $12.24, and in 2018, this rose only 3 cents to $12.27. While other career paths their pay has inflated appropriately over the time interval. Joanne and her fellow direct care workers' wages haven't changed and their jobs do not remain competitive. Low wages and few benefits in the direct care sector leads to high rates of employee turnover. Unfortunately, Joanne may seek work elsewhere in the near future. Furthermore, Carol, the RN, could be paid better working as an RN in another facility, such as a hospital or at a primary care outpatient clinic. She chooses to stay at Longevity Living because she feels emotionally attached to her clients, but also senses this emotional work is something she is forced into. Registered nurse to resident ratios and CNA to resident ratios vary by state, but they are extremely alarming. At Longevity Living, Carol, one of the registered nurses, oversees the care of 30 patients for her 8-hour shift, which is only 16 minutes with each resident if she works continually without any breaks and without accounting for time between patients. Clearly, there's a staffing issue within nursing homes, but with more staff, that means more employees to pay, which Greg is trying to avoid. Greg is focused on profit. However, he believes Medicaid reimbursements are much too low to cover operational costs. He considers Medicaid beneficiaries to be net financial losses for the nursing homes and relies heavily on incomes from out-of-pocket patients. He is stuck pushing for proper treatment documentation for reimbursements, but as a result, from being so removed from the care team, he doesn't realize that real-life human beings do not act according to the categories constructed by any system. As Larry Churchill states, the current medical care system is not designed to meet the health needs of the population. It's designed to protect the interests of insurance companies, pharmaceutical firms, to an extent, organized medicine. It's designed to turn a profit. It's designed to meet the needs of the people in power. And unfortunately, in this case, Greg is in power. It has been found that care in as many as 1/3 of nursing homes jeopardizes the health and safety of residents. Clearly, we need change. The states are responsible for monitoring and enforcement of quality standards among nursing homes, which have become extremely lax. Change needs to happen at the national level. The U.S. government should regulate how nursing homes spend their government funds in order to take care of residents like Karen. The average annual cost for residential care averages around $90,000, when the average individual only has about $9,000 in savings by the time they arrive. The path to poverty is quick, and Medicaid only serves as a safety net after individuals spend their entire acquired wealth. Often, at this point, too, it is too late for those who need Medicaid assistance. They may be placed on a waiting list, they need care that exceeds Medicaid's limits, or for any other reason they are considered ineligible. Medicaid can't pay for proper care because it is underfunded. Its funding comes mainly from general tax revenues, and it has to compete with other programs in states' budgets that often fall of greater importance. This contributes to the stress documentation of care that Greg pushes for because sadly, medicine has become corporatized by institutional payers such as governments and employers to get more effective health care for less money. There has been federal recognition of the long-term care funding issue and the introduction of the Community Living Assistance Services and Supports Plan, implemented as part of the Affordable Care Act, which would provide $50 a day to be used toward long-term care costs. But the plan never came to fruition given the concerns about economic stability. Instead, any advancements have had to take place at the state level. Changes at the state level do provide feasible actions for change in the nursing home financial system, but there will need to be participation from more states to make a change that significantly impacts the situation for the nation as a whole. One potential change could be to divide the Medicare budget such that specific amounts are going to specific sectors of care. This would benefit all individuals involved, including those receiving care such as Karen, those providing care such as Joanne and Carol, and remove some stressful budgeting decisions made by corporate executives such as Greg. Undoubtedly, the current nursing home system in our nation needs revamping. With an extremely rapid growing population of old people, sure to result in growing numbers of nursing home residents, change needs to happen now more than ever. Direct care workers are the occupation with the largest projected job growth, yet it has extremely poor quality. With the right interventions, sooner rather than later, realignment of the nursing home system may arise to benefit those with an institution like longevity living.